This conference will now be recorded.
And this is Medicare 101, a basic understanding to your Medicare options. The way this is set up is this is 100% virtual. This will be the first time here that we've done one of these, that we don't have an active audience here. So if you guys at home have any questions, you can definitely, there is a react or raise your hand button. Or you can type it into our chat. I'd be more than happy to stop and answer any questions that you might have. And then at the end, what we'll do is we'll go ahead and again, I'll just make sure that no one had any unanswered questions or concerns, and we can go from there. So to kind of kick this off, again, Medicare 101, a very high level overview of Medicare. Okay, so we'll begin. Who is eligible for Medicare? Ways of becoming eligible. First of all, 65 or older. There are ways of becoming eligible if you're not yet 65. If you're under 65 and receiving Social Security disability payments for more than 24 months, then you are also eligible for Social Security. I'm sorry, for Medicare. Illness, any age with end-stage renal disease, or known as ALS, you are also eligible for Medicare. And you must be have qualified residency. You must be a U.S. citizen or permanent resident for 5 consecutive years. Any of those will get you eligibility into Medicare. For Medicare enrollment, if you have a Social Security number if you are collecting Social Security when you turn 65, you'll be automatically enrolled into Medicare. You'll receive your Medicare card 3 months prior to your birthday. If you do not receive your Social Security when you turn 65, you'll need to take the appropriate steps to start Medicare. There's a couple different ways to do it. You can go online. You can call Social Security to apply over the phone, or you can go into your local Social Security office. Either of those ways, you can go ahead and get Medicare enrollment. All right, the Medicare basics. So there is 2 parts to original Medicare. There is Part A, that is your hospital insurance, and there is Part B, that is your medical insurance. You do have options for additional coverage. You don't have to just stick with Part A and Part B. You can go 2 different routes. The first route is with what they call a Medicare supplement plan. If you do happen to purchase a Medicare supplement plan, then you also do need to purchase, most of them won't cover Part D, which is your prescription drug. That is something that you will need to purchase. You can also do what they call a Part C, which is your Medicare Advantage. Your Medicare Advantage typically will include your Part D coverage, so all of that is included. So that is just a more inclusive policy or a more inclusive choice. Okay, going back to original Medicare Part A. Remember, this is your hospital insurance. What this provides coverage for is any inpatient hospital care, any skilled nursing facilities, hospice care, or limited home health care. This is not a complete list. It's just kind of giving you an idea of what Part A would cover. Cost. So if you are eligible and paid into Social Security for 40 quarters, you pay 0 for Part A. There is nothing you pay for that. If you're eligible and paid in at least 30 quarters, then you have a reduced cost. It would be about $311. Your cost would be $311 monthly. And if you're eligible and you paid in less than 30 quarters, then your full cost is $565. That's your monthly premium. If you don't qualify on your own, you may be eligible based on your spouse's work history when you turn 65. Okay. Now, Part B, original Medicare Part B. This is like your doctor visits, your preventative services, could also cover your outpatient surgery, any diagnostic screenings, your emergency care, and your durable medical equipment, Again, not a complete list, just trying to give you an idea of what Part B would cover. The cost for Part B. The standard premium for Part B is $202.90. That is for 2026 per month. It can be higher depending on your income. So you'll pay a higher premium than that if you make more than $109,000. If you file an individual tax return or married and filed separately. $218,000 if you're married and filed a joint tax return. So most people pay about the $202.90. Part B, some of you guys may have heard of this. There is a late enrollment penalty. If you did not sign up for Part B when first eligible and not covered by credible employer plan, you may have to pay a late enrollment penalty for as long as you have Part B. The monthly cost may go up 10% for each full 12-month period that you could have enrolled in Part B, but didn't. There are some exceptions. You do not have to pay a late enrollment penalty if you meet certain conditions that allow you to sign up for Part B during a special enrollment period. So there are some exceptions to where you may not have to pay that. For the most part, if you had credible insurance, meaning you had your health insurance through another provider and you didn't need to sign up for Medicare, then chances are you won't have to pay for that penalty. Okay, so what does Medicare cover? Original Medicare generally covers up to 80% of your hospital and medical expenses. So what Medicare does not cover is or original Medicare, what it does not cover is your deductibles, your copays, your coinsurance, your outpatient prescription drugs, healthcare outside of the US, hearing aids, exams, screenings, routine eye exam and glasses, and routine dental. None of that is covered under original Medicare. Okay, so we're going to go into a little bit more what you can get on top of original Medicare. That first option we were talking about is called a Medicare supplement, also called Medigap. Same thing. Medigap can fill some of the gaps that original Medicare does not cover. Oops, sorry. It can cover your deductibles, your copay, your coinsurance. It gives you freedom to choose any Medicare appointed doctor in the US. It definitely opens things up for you there. It is a standardized plan with associated services and has a monthly cost and will vary based on the insurance company. So you've probably heard of those plans. They're like the G plan, the H plan. That's what they're referring to when they're talking about a Medigap policy or a supplement policy. Okay, Medicare supplement plans do not cover prescription drugs. Drug coverage can be added separately through a prescription drug plan or other credible coverage. Okay. Part D, again, is a prescription drug plan. There are two types of Part D coverage. There's a standalone drug plan, and that you must have original Medicare Part A, Part B, or both as a part of a Medicare Advantage plan. So Medicare Advantage plans will cover your Part D and then of course on top of that, you do have to carry Part A and Part B coverage. Part D covers some prescription drug costs. You must continue to pay your Part B premium, and you must live within Part B's plan service area. So that is something that you would recognize when signing up. You enter your zip code and you'd find your service area that way. Part D, there is a late enrollment penalty for Part D as well. So if you did not sign up for Part D when first eligible and did not have credible insurance for more than 63 days, you may have to pay a late enrollment penalty for as long as you have Part D. Here's an example of what a penalty may be. It's 1% of the national base premium, which is about $38.99, multiplied by the number of months you were not covered while eligible. For example, the national base premium for 2026 was that $38.99. If you signed up within 2026 after missing 10 months of coverage, your monthly penalty would be $3.90. That is the $38.99 times the 10% and round it to the nearest tenth. Okay, so your prescription drug coverage changed based on the coverage stage that you're in. So there's 3 different stages to Part D. When you first sign up for it, it's the amount you pay before the prescription, it's the amount you pay before a plan covers your prescription drug cost. So that's going to be a deductible range. The maximum is $615. So that's the amount of pay you pay out of pocket before you start getting really the coverage for Part D. Stage 2 is your initial coverage. The plan pays its share of the cost, and you pay your share of copays and coinsurance. The maximum out-of-pocket coverage that you would have to pay for Part D is $2,100. That's your maximum out-of-pocket. And then after that, you enter what's called the catastrophic stage. After that, they make it sound like it's a bad thing, but after that, you reach the maximum out-of-pocket. The plan will pay your covered drug costs for the rest of the year. So you're done paying. They pay for the rest. There are no copays or coinsurance for the covered drugs for the remainder of the plan year. You can save on drug costs. If you meet certain income and resource limits, you may qualify for extra help from Medicare to help pay for the cost of your Medicare prescription drug coverage. That's your Part B. You can apply. It gives an address here, an email, a link, an internet link here. Also, when you are ready to sign up, if you ask your representative, they can definitely get you that information. What's counted as assets towards to see if you qualify for the extra help. They will look at any countable assets. That is money in your checking account, money in your savings, retirement accounts, your stocks, your bonds. What they will not look at is your home, one of your cars, a burial plot if you have one, up to $1,500 for burial expenses if you have put the money aside, any of your furniture, other household or personal items. Alrighty, so our Medicare Advantage plan, again, that's our Part C. Medicare Advantage plans are offered by private insurance companies approved by Medicare and is an alternative to original Medicare. You must continue to pay your Part B premium. So you're always going to have that $202.50. And then you can get an Advantage plan on top of that. That is your Part C. That is going to entail your original Part A coverage, that's your hospital coverage, your original Part B, that is again your medical coverage, and your Part D. Most of them carry the Part D. I don't really know a lot that don't. And that's going to be your prescription drug coverage. If you put all of those together, your A, your B, and your D, that's what it kind of entails or enholds like Part C. Okay, so enrollment periods. When can you start enrolling? Okay, so original Medicare has an initial enrollment period. You might hear it, people say IEP very frequently. You technically have 7 months. You have the 3 months before your birth month, you have the month of your birth, and then you have 3 months after your birth month to enroll in Medicare. There might be a special enrollment period, circumstances within the year, and you can sign up for that. For a Medicare Advantage, there is 2 main times when people do this. Typically, your annual enrollment period is October 15th through December 7th. That is when you're not originally enrolling into Medicare, if you want to enroll into an Advantage plan, you can do so October 15th through December 7th. And then there is also what they call an open enrollment period. That is from January 1st through March 31st. That is when you're able to go from one Advantage plan to another. So if you already got enrolled into one, you did not like it, you wanted to change to a different Advantage plan, you're able to do so through that January 1st through March 31st. That's that open enrollment period. All right, so there is also a Medicare supplement enrollment period. Again, a 6-month window that begins on your Part B effective date or 65th birthday, whichever is later. There is no medical underwriting during the initial 6-month enrollment period. So I will kind of help break that down for you. So if you do want to enroll in a Medicare supplement plan, it is a good idea to do so when you're directly going into Medicare for the first time, because they are not underwriting during that period. So if you have perhaps a major health concern, there are no restrictions. They do have to take you because there is no underwriting. If you start off with an Advantage plan and then go into supplement at a much later date or a later date, it is underwritten, your premiums are affected, and there is a chance that you cannot be accepted into a supplement plan. You can choose from any Medicare supplement plan option. Medicare supplement guaranteed issues. Oh, this is a little bit more into it. So there are several other guaranteed issue situations to enroll into a Medicare supplement plan with no underwriting. For example, loss of coverage, moving into a new area, and many more. So if you have to move from one area to another and your current plan is no longer offered there, you can then get a special situation, and you can get in then as well into a Medicare supplement plan. All plan options may not be available. If you do not qualify for a guaranteed issue situation, you may need to undergo medical underwriting. Star ratings. Okay. So each Medicare Advantage and prescription drug plan is assigned a star rating from 1 to 5 stars. They get those star ratings from a couple of different places. They'll look at member satisfaction surveys, plans and providers, so they'll see what everyone thinks. Performance measurements based on 40 key factors. Additional information is available on Medicare.gov if you want to .com if you want .gov if you want to look a little bit more into that. I don't really see many 5 stars anymore. Usually they're, from what I see, they're anywhere from about 2 to 4 point something stars. So those are on the different Medicare sites. All right, so my service to you. You may have many options for coverage. You can continue with your employer if you're still working and that employer has over 20 employees. So many companies will allow you to keep working after you hit the age of 65. You can continue with their retiree and military plan if applicable. You can enroll in Part C Medicare Advantage plan, which can include your Part D, which is your prescription drug coverage. Or you can enroll in Original Medicare and a Medicare supplement plan and a standalone Part D prescription plan. So you can continue with what you're doing typically if you are with if you are still working and you do want to continue with that plan. That is credible coverage. You can continue with your retiree or your military plan if that's applicable. If not, you do need to enroll into a Part C Advantage plan or into a supplement plan. During your appointment, we'll review your needs to help find the right plans available for you to choose from. Some of the questions we determine to figure out what plan is right for you is, when did your Medicare start? What zip code do you live in? Who are your primary doctors? What specialists do you see? What medications do you take? And are you looking for certain services? These are all questions that I would ask just to make sure we put you in the right plan. Want to make sure your doctors are covered and your prescriptions are covered. If you're ready to find a plan that fits you, my name is Michelle Brooks. I am here at OC Federal. If you have any additional questions, you can definitely feel free to ask them now. If you don't want to ask them now, that is absolutely fine. If you call OC Federal and let them know that you want to talk to anyone about Medicare, they will get you over to me, and I'd be more than happy to go over any additional questions one-on-one over the phone, or if you want to come in. Either way, I will go out to any of the offices here at OC Federal. More than happy to meet you guys. I do want to open it up. Did anyone out there have any questions or concerns? Anything you'd like me to cover a little bit further? Okay. If anyone out there thinks of anything, you can definitely give us a call. Again, my name is Michelle Brooks. You don't even have to know that. If you just let your representative know when you call in that you want to ask about Medicare or want further explanation, they will get you right over to me. More than happy to go over any other options or any specific details that you guys might have. In the meantime, again, wanted to thank you guys for all coming in, taking time away from your family and your dinner. I hope you guys have a great night, and I hope to hear from you guys soon. Thank you.